Hey everybody, it's Gary from Babs Beauty Warehouse coming to you. And as promised, I'm going to talk to you about you being your own advocate for your health care and you being able to correct the doctor, uh, you being the best person for you in your medical journey. I don't know how else to put it. All right, so let me give you the background story. About 2 years ago, we were sitting at Bob Evans because Babs likes Bob Evans, and she noticed one of my pupils was larger than the other. This is a great concern. Me having a history in the medical field, I used to be a paramedic many years ago. This concerned me a great deal, so called up the doctor, got an MRI. There's nothing wrong with my brain, nothing wrong with my optic nerves. Um, they sent me to an ophthalmologist, and looking at it, they found that there's scar tissue from uveitis in my left eye. So my left eye does not open and close. The pupil does not constrict and open and close, and this eye here is sluggish. So that information went to my regular doctor. I've carried that information in my brain. I've been through a lot of eye doctors lately, but this eye is fixed. This eye is sluggish. So, about 3 months ago, I go in for my yearly physical, and we're going through everything and going through the blood work and this and the that. You guys know the routine. So, he's checking my ears, and he says, "Yep, ears look good." And then he shines the light in my eye and he says, "Pupils are equal and reactive." And I'm thinking to myself, what the heck is he talking about? This eye is not reactive at all. These pupils are not equal. This eye is sluggish. So I corrected him, and as you should. And he said, "Thank you for telling me." And I'm thinking to myself, what the heck is going on here? He just looked at my eyes and said they were equal and reactive. They are neither equal nor reactive, sluggish, fixed. I don't understand. I just don't understand, but I corrected him. He thanked me, and we moved on. And I'm thinking to myself, what else did he miss? What? I mean, it's so obvious what's going on here. Do I need a new doctor? Put down in the comment sections. Do I need a new doctor? Do I need a new general practitioner or internist? This had me greatly concerned. All right, so moving on. I didn't do anything about it. I'm moving my microphone around. Hello, testing 1 2. So it bothered me. I told Babs, and I mean, who do you tell? Who do you say? Hey, a higher up doctor, my doctor missed my eyes total. He said they were something they weren't. So I did nothing. Wrong. That's wrong. I did nothing. Besides, I corrected him. Maybe he learned a lesson from that. Okay. So, as some of you know, I went to the emergency room Sunday morning. I had a cardiac issue. My heart was in tachycardia. It wasn't in VFib or AFib. It was just beating really fast. It was going on 2 hours. So I went to the emergency room, which luckily is right around the corner from the house. And usually my heart, when this is not something that hasn't happened to me before. My heart usually reverts back. This time it wasn't reverting back to a normal heartbeat, to a normal speed. So after an hour, everybody sitting around wishing that it reverted, they put a drug on me to stop my heart and restarted my heart. Okay, fine, it worked. I'm good. It worked. So I, after it worked, they pretty much said, "Hey, you can go home." So I drove home. The next day, I pulled the paperwork, and I'm reading through it of everything they found in the emergency room, and lo and behold, There it was again. My eyes were equal and reactive. Now, I know for a fact they didn't shine a light in my eyes even to check it. And there were other things that they did not check that said were done there. They were not done. And I seem to seeing this more and more going back through my medical records, things I've supposedly done for the sake of Expedia, whatever, for the sake of getting me out of there quicker. They assume that those things are okay. Now, if you looked at my eyes, you could tell that one pupil is bigger than the other. You just look at them. Now, in a setting for an emergency room and somebody having heart issues, that is a real signal when one pupil is larger than the other that there's something wrong there. Now, they did not know that one is fixed and one is sluggish because my optometrist records is not on my medical records or that the hospital would have access to. So they had no access to that information. They should have looked at my eyes and see they're not working correctly and looked at it and said, hey, your pupils are different. Do you have an issue or do we need to look into this? Because if I'm not mistaken, having a stroke, now I'm in there for a heart situation, having a stroke will cause one pupil to be a different size than the other. Now, I could be wrong about that, but I don't think that I am. I'd have to Google it, and then Google could be wrong about that. So I guess what I'm saying here in this long-winded video, you got to check everything. You got to go and say, hey, I don't remember you doing this. Hey, no, that's not correct. Hey, we need to look into this a little bit more. This isn't right. We need to do this. This is really, really important because they missed this. They purposely missed this. They didn't look for it. They assumed that it was, and it's not. What if it was somebody that didn't have my condition and where the pupils were different in different sizes and didn't have what I have? That is a signal that there is something really wrong. Something really, really wrong. We know mine is from scar tissue, but that's not normal. What I have is not normal, but it's not a problem per se. But what if it was somebody that had a problem? And look, your eyes are equal, but they're not equal. It could be a much larger medical problem that they're going to miss because they didn't do their job. I can't trust how my ears were. I can't trust anything that the doctor said in relation to this, both in the emergency room, even though they fixed me, something like that, you get wrong, it's wrong. And musicians, this is why musicians have interesting things in their clauses when they play a show, like no brown M&Ms, because if the arena or whatever, or whoever's doing the show, doesn't pay attention to that, there's a good chance that they're not paying attention to the more important thing than removing brown M&Ms out of M&Ms. All right, that's my rant. That's a lot of you know I was going to go and put up this video. So I hope this helps some of you. Take control of your own health care. Make sure if people are getting things done. Drug interactions. You ask, what am I to expect when you prescribe this drug to me? What about the other drugs that I'm on? And what kind of side effects is this going to happen? What's going to happen with this? What are the possibilities? What are the remote possibilities? What are the remote? I don't know, the opposite of remote possibilities. You all know what I mean. Take care of your health care. This is Curry ranting. I won't rant anymore for a while, and we'll see you in the next video.